practices have faced many challenges, I think, as they implement electronic patient-reported outcomes in their practice. And OncoPRO has been an amazing collaboration that has allowed us to share information about where we're having struggles and how to creatively solve for those. So some early challenges have been things like vendor selection, like how to introduce the tool, how to, at what frequency to have reporting, how to make sure that patients are in fact reporting, and how you respond to those queries. By having a dynamic environment of like-minded individuals that are trying to transform cancer care in this way and share information about what's working and what's not working, we've really been able to work together to create collaborative solutions that have helped us all be better. A few things that we have looked at is obviously the structure of the tool that you're using for electronic patient-reported outcomes, or ePRO reporting, is really important. It does need to be simple. Also, we found through our discussion on OncoPRO that things like reminders to patients for reporting is really important. Thinking about having them report at regular intervals and on demand. So we've had a lot of discussions about some of these different kinds of methodologies we can use to improve adherence in the OncoPRO group, and it's been incredibly helpful. It's a great question. I think the collaboration is really important by bringing the EHR vendors and the clinicians together, because we need to have infrastructure changes in order to be optimal. If you make ePROs difficult because they're on separate systems and they're not integrated, then it will decrease adoption. People aren't going to do it because they're not going to respond to it in a timely fashion. It will be hard for their clinicians to see it. We really have to have optimal integration and have it at everyone's fingertips in order for the system to work as it should. We have a lot of things that we've learned from OncoPRO and how we implement. We've developed a standard process workflow and how we onboard patients onto the ePRO tool. So we've decided where in that journey that occurs, how exactly that occurs. I think that's an important decision around implementation. We've discussed how we think about reminders for patients, how we think about facilitating adherence, and we've implemented changes in our practice to try to improve upon that. And I think they've been really effective. It's a great question. So OncoPRO is really timely because many practices are having to newly adopt ePROs in order to be compliant with the EOM, or the Enhancing Oncology Model, which is CMMI's value-based care cancer pilot. I think the due date is July of this year for them to all have ePROs. We've had ePROs in my practice for 5 years, so so a lot of them are having to newly do this. So it's critical actually to have this information out there, because practices are having to navigate this landscape, and we want it to be better. And we want it to be better not only because it's important for EOM, but because we know that in patients with advanced cancer, participating with ePROs allows them to have better symptom control, reduced ER visits, reduced hospitalization, and lower cost of care. And we've studied and published on this. Others have studied and published on this. And so really, we know that it's accomplishing what we want it to accomplish if we do it right. And I would say that environment is changing, because we see as there's more and more adoption, there's a lot more interest in, if we're spending all of this time and effort and all of this nursing workforce to control patient symptoms, how do we bill for this service? How can we be reimbursed appropriately for this service? And so there are a series of remote therapy monitoring codes that can be billed for the service of symptom monitoring with ePROs and management that I think are really important, that are a reasonable way, a sustainable way for practices to implement this without a lot of economic hardship. I think OncoPRO is a really important way to help shape implementation of ePROs throughout the country and throughout the world, actually, because you're having different practices, different organizations, different EHR vendors, and we can all troubleshoot how we're incorporating these different solutions. So I think what emerges from that is a best set of principles. I think between those principles, any advice coming out of ASCO, ESMO has guidelines around ePRO implementation. Those things will shape the future of ePROs and symptom control in cancer patients.